Welcome to the next installment of Ultrasound Case of the Week. We won't be covering anything groundbreaking this week, but we will be taking a look at an interesting case of using ultrasound to diagnose a Foley blockage. The patient this week is an 80-year-old man who had a TURP procedure done and was sent home with a Foley. He returned to the emergency department with urinary retention. After trying to irrigate the Foley, there was a lot of resistance. An ultrasound of the bladder did show this, however. You can see a bladder here with the Foley balloon in the middle. It's not as hypoechoic as we would expect, but maybe there is some air that gave it some echogenicity. We do have this structure here, however, and that's all clot. We can see in a transverse image that we have the Foley balloon again in the middle, completely surrounded by clot. What does that remind you of? Yummy. So with that amount of clot, the patient eventually was admitted to the urology service, had 8 hours of continuous bladder irrigation, and eventually was discharged home with good outcome. So that's it for our ultrasound case of the week. It's just another example of how ultrasound can be useful when trying to troubleshoot Foley problems.